Question 1. A nurse enters the room of a patient with active tuberculosis who is coughing without a mask. What is the nurse's first action? A. Leave the room immediately and call for assistance. B. Instruct the patient to wear a surgical mask. C. Don a new N95 respirator before approaching the patient. D. Notify infection control. Answer. C. Don a new N95 respirator before approaching the patient. Rationale. The nurse must protect themselves before intervening. Wearing an N95 respirator ensures safety during exposure. Afterward, the patient can be instructed to wear a surgical mask. Question 2. A patient with tuberculosis reports orange-colored urine. What is the nurse's best interpretation of this finding? A. It indicates liver toxicity from isoniazid. B. It is a normal side effect of rifampin. C. It means dehydration. D. It suggests renal impairment. Answer. B. It is a normal side effect of rifampin. Rationale. Rifampin causes orange discoloration of body fluids and is harmless. The nurse should reassure the patient. Question 3. A patient with tuberculosis suddenly develops shortness of breath, tachycardia, and hypotension. What complication should the nurse suspect? A. Pleural effusion. B. Pulmonary embolism. C. Pneumothorax. D. Drug reaction. Answer. C. Pneumothorax. Rationale. TB can cause lung tissue destruction leading to pneumothorax. Sudden respiratory distress and hypotension are key indicators. Question 4. Which nursing intervention best prevents transmission of tuberculosis in a healthcare setting? A. Wearing gloves during all patient contact. B. Placing the patient in a private room with negative pressure. C. Using droplet precautions. D. Limiting visitors to family only. Answer. B. Placing the patient in a private room with negative pressure. Rationale. TB is airborne. Negative pressure isolation prevents spread to others. Question 5. The nurse observes an unlicensed assistive personnel, UAP, entering a TB patient's room without a mask. What is the nurse's priority action? A. Instruct the UAP to leave the room immediately. B. Report the incident to infection control. C. Allow the UAP to continue and educate later. D. Ask another nurse to intervene. Answer. A. Instruct the UAP to leave the room immediately. Rationale. Immediate safety action is required to prevent exposure. Education follows after ensuring protection. Question 6. A nurse is teaching a newly diagnosed TB patient about medication adherence. Which statement indicates the need for further teaching? A. I should stop taking the drugs when I feel better. B. I need to take all my medications exactly as prescribed. C. My family may need to be tested for TB. D. I should expect treatment to last several months. Answer. A. I should stop taking the drugs when I feel better. Rationale. Stopping medication early can lead to drug resistance and relapse. Question 7. A patient receiving isoniazid therapy reports numbness and tingling in hands and feet. What should the nurse do? A. Encourage rest and hydration. B. Notify the healthcare provider for pyridoxine supplementation. C. Document the finding and continue therapy. D. Administer oxygen. Answer. B. Notify the healthcare provider for pyridoxine supplementation. Rationale. Isoniazid can cause peripheral neuropathy. Vitamin B6 pyridoxine prevents it. Question 8. A patient on TB treatment develops jaundice and dark urine. What is the nurse's first action? A. Hold the medication and notify the provider. B. Encourage fluids. C. Continue the medications as prescribed. D. Reassure the patient this is normal. Answer. A. Hold the medication and notify the provider. Rationale. Jaundice may indicate hepatotoxicity, especially from isoniazid or rifampin. Stop the drug immediately. Question 9. Which task can the nurse safely delegate to an unlicensed assistive personnel, UAP, caring for a TB patient? A. Assessing respiratory status. B. Teaching about medication side effects. C. Assisting with bed linen change using proper PPE. D. Monitoring adherence to drug therapy. Answer. C. Assisting with bed linen change using proper PPE. Rationale. The UAP may perform non-assessment tasks under supervision using correct precautions. Question 10. The nurse suspects a patient with a chronic cough and night sweats has TB. What is the priority nursing action? A. Place the patient in airborne isolation. B. Obtain a chest X-ray. C. Collect a sputum sample. D. Notify the provider. Answer. A. Place the patient in airborne isolation. Rationale. Preventing transmission is the top priority before diagnostic confirmation. Question 11. During discharge teaching, which statement by a TB patient indicates understanding of infection control? A. I will use a tissue to cover my mouth when coughing. B. I will stop wearing a mask once I start medications. C. I can share utensils with my family once I feel better. D. I will store my medications in the refrigerator. Answer. A. I will use a tissue to cover my mouth when coughing. Rationale. Covering the mouth prevents droplet spread. Mask use continues until sputum cultures are negative. Question 12. A nurse caring for multiple patients must decide who to see first. Which patient should the nurse assess first? A. A patient with TB who has a temperature of 99 degrees Fahrenheit. B. A patient with TB complaining of hemoptysis. C. A patient awaiting a sputum culture. D. A patient requesting discharge education. Answer. B. A patient with TB complaining of hemoptysis. Rationale. Hemoptysis may indicate lung tissue damage or hemorrhage. This requires immediate assessment. Question 13. The nurse receives a new admission diagnosed with suspected TB. What is the priority initial nursing intervention? A. Initiate airborne precautions. B. Administer the first dose of antibiotics. C. Obtain baseline vital signs. D. Prepare for discharge teaching. Answer. A. Initiate airborne precautions. Rationale. Infection control begins immediately upon suspicion of TB. Question 14. A patient with TB is prescribed multiple antibiotics. The patient asks, "Why do I need so many drugs?" What is the best response by the nurse? A. Multiple drugs prevent resistance and increase effectiveness. B. It shortens the duration of treatment. C. Your infection is severe, so you need many medications. D. It helps with your appetite and energy. Answer. A. Multiple drugs prevent resistance and increase effectiveness. Rationale. Combination therapy reduces the risk of resistant TB strains. Question 15. A nurse is preparing to administer morning medications to a TB patient. Which action demonstrates safe nursing practice? A. Crushing the medications for easier swallowing. B. Wearing gloves and an N95 respirator during administration. C. Allowing the patient to take pills unsupervised. D. Leaving the door open for better ventilation. Answer. B. Wearing gloves and an N95 respirator during administration. Rationale. Airborne precautions must be maintained during all interactions. Question 16. A nurse teaching a community group about TB prevention includes which key point? A. TB spreads through contaminated food. B. TB is spread through airborne droplets. C. TB can be prevented by wearing gloves. D. TB is transmitted only through blood contact. Answer. B. TB is spread through airborne droplets. Rationale. TB spreads via inhalation of Mycobacterium tuberculosis droplets from infected individuals. Question 17. A patient with TB is started on directly observed therapy DOT. What is the purpose of this program? A. To monitor for medication side effects. B. To ensure adherence to the treatment regimen. C. To shorten the treatment duration. D. To provide nutritional support. Answer. B. To ensure adherence to the treatment regimen. Rationale. DOT ensures patients take their medications correctly, preventing resistance and relapse. Question 18. The nurse is planning care for a patient with TB and HIV. Which intervention has the highest priority? A. Monitor for signs of hepatotoxicity. B. Assess for potential drug interactions. C. Reinforce the need for adherence to TB treatment. D. Encourage daily exercise. Answer. C. Reinforce the need for adherence to TB treatment. Rationale. Immunocompromised patients are at higher risk for relapse. Adherence is vital. Question 19. A patient on long-term isoniazid therapy complains of fatigue, nausea, and yellowing of the eyes. What should the nurse do first? A. Hold the medication and notify the provider. B. Offer small frequent meals. C. Encourage fluid intake. D. Document the findings. Answer. A. Hold the medication and notify the provider. Rationale. These are signs of hepatotoxicity. Immediate discontinuation and provider notification are essential. Question 20. During a home visit, a nurse observes that a TB patient's family members are not wearing masks. What should the nurse do first? A. Educate the family about airborne precautions. B. Report the family to public health authorities. C. Provide additional N95 masks for use. D. Instruct the patient to isolate outdoors. Answer. A. Educate the family about airborne precautions. Rationale. Education is the first step in ensuring compliance and preventing community transmission. Question 21. A nurse finds that a tuberculosis patient in a negative pressure room has left the unit without wearing a mask. What is the nurse's priority action? A. Notify infection control and security immediately. B. Document the incident in the patient's chart. C. Search for the patient on the hospital grounds. D. Re-educate the patient when they return. Answer. A. Notify infection control and security immediately. Rationale. Public safety and exposure control take precedence. The infection control team initiates emergency procedures to locate and contain the exposure risk. Question 22. A nurse is reviewing medications for a TB patient who takes oral contraceptives. What instruction is essential? A. Continue your regular contraceptive method. B. Rifampin can reduce birth control effectiveness. Use additional protection. C. Switch to long-acting birth control. D. Take your TB medication at bedtime. Answer. B. Rifampin can reduce birth control effectiveness. Use additional protection. Rationale. Rifampin induces hepatic enzymes that decrease oral contraceptive efficacy. Additional contraception is necessary. Question 23. During shift change, the nurse learns that a TB patient is refusing to wear a mask during transport to radiology. What is the best nursing action? A. Cancel the transport until the patient agrees to wear a mask. B. Proceed quickly to minimize exposure. C. Provide a face shield instead of a mask. D. Escort the patient through non-patient areas. Answer. A. Cancel the transport until the patient agrees to wear a mask. Rationale. Transporting an unmasked TB patient endangers others. The procedure must be delayed until precautions are in place. Question 24. A nurse is caring for a patient with multi-drug-resistant tuberculosis, MDR-TB. What PPE is essential before entering the room? A. Surgical mask and gloves. B. N95 respirator, gown and gloves. C. Face shield and gown only. D. Standard gloves and goggles. Answer. B. N95 respirator, gown and gloves. Rationale. MDR-TB requires airborne and contact precautions for maximum protection. Question 25. A TB patient states, I don't want my family to know I have this disease. What is the nurse's best response? A. I understand, and I will keep your condition confidential. B. By law, TB must be reported to public health authorities. C. I'll tell your family only if they ask. D. You can refuse to disclose this information. Answer. B. By law, TB must be reported to public health authorities. Rationale. TB is a reportable communicable disease. Confidentiality is limited by public health obligations. Question 26. A patient on TB treatment develops hearing loss. Which medication does the nurse suspect as the cause? A. Rifampin. B. Ethambutol. C. Streptomycin. D. Isoniazid. Answer: C. Streptomycin. Rationale: streptomycin, an aminoglycoside, may cause ototoxicity, leading to hearing loss. Question 27. A nurse notices that a patient's N95 mask is loose during care. What should the nurse do first? A. Continue care to avoid alarming the patient. B. Step back and refit the mask properly. C. Request a new mask after completing the task. D. Adjust it once care is finished. Answer: B. Step back and refit the mask properly. Rationale: a proper seal is vital to prevent inhalation of airborne Mycobacterium tuberculosis. Question 28. A patient with TB and diabetes mellitus presents with rising blood glucose levels. What is the most likely cause? A. Drug-induced hepatotoxicity. B. Rifampin decreasing insulin efficacy. C. Stress from hospitalization. D. Isoniazid interfering with oral hypoglycemics. Answer: D. Isoniazid interfering with oral hypoglycemics. Rationale: isoniazid may decrease the effectiveness of certain diabetes medications, raising glucose levels. Question 29. A nurse is preparing to teach a group of healthcare workers about TB prevention. Which point is most important to emphasize? A. Use surgical masks for all coughing patients. B. Airborne precautions must begin at the first sign of suspicion. C. Patients can be cohort in shared rooms. D. Gloves alone prevent transmission. Answer: B. Airborne precautions must begin at the first sign of suspicion. Rationale: early isolation prevents hospital-wide transmission and protects healthcare staff. Question 30. A nurse suspects that a newly admitted patient with chronic cough, fever, and weight loss may have TB. What should be done first? A. Notify the provider to order sputum cultures. B. Place the patient in a negative pressure room immediately. C. Begin empiric TB therapy. D. Draw blood for TB testing. Answer: B. Place the patient in a negative pressure room immediately. Rationale: infection control is the top priority before diagnostic confirmation. Question 31. A nurse is assigned to care for 4 patients. Which should the nurse see first? A. A TB patient with new onset hemoptysis. B. A TB patient reporting fatigue. C. A TB patient asking about nutrition. D. A TB patient with a mild headache. Answer: A. A TB patient with new onset hemoptysis. Rationale: hemoptysis may indicate hemorrhage or cavitary lung damage. Urgent assessment is required. Question 32. During DOT directly observed therapy, a patient refuses to take TB medications, saying, "I feel fine now." What should the nurse do? A. Respect the patient's decision and document. B. Explain the importance of full treatment to prevent relapse. C. Skip the dose for today. D. Call law enforcement. Answer: B. Explain the importance of full treatment to prevent relapse. Rationale: education is the first step to improve adherence. Noncompliance can cause resistant TB strains. Question 33. A nurse discovers that a patient with active TB was mistakenly placed in a semi-private room. What is the nurse's immediate action? A. Move the patient to an airborne isolation room immediately. B. Report the error to the charge nurse later. C. Ask the roommate to wear a surgical mask. D. Wait until the provider arrives. Answer: A. Move the patient to an airborne isolation room immediately. Rationale: immediate isolation prevents potential airborne exposure to the roommate. Question 34. The nurse is caring for a TB patient whose sputum culture has just returned negative. What should the nurse do next? A. Discontinue airborne precautions. B. Wait for 3 consecutive negative sputum results before discontinuing isolation. C. Notify housekeeping to clean the room. D. Remove the N95 mask. Answer: B. Wait for 3 consecutive negative sputum results before discontinuing isolation. Rationale. TB isolation is maintained until 3 consecutive negative cultures confirm non-infectious status. Question 35. The nurse notes a TB patient's ALT and AST levels are elevated. What is the priority action? A. Stop hepatotoxic medications and notify the provider. B. Continue therapy and monitor weekly. C. Encourage fluids and rest. D. Report to Public Health Department. Answer. A. Stop hepatotoxic medications and notify the provider. Rationale. Elevated liver enzymes suggest drug-induced liver injury, often due to isoniazid or rifampin. Question 36. The nurse observes that a patient with TB is spitting into tissues and leaving them on the bedside table. What should the nurse do first? A. Dispose of tissues in a biohazard bag and educate the patient. B. Call environmental services. C. Instruct housekeeping to clean the area. D. Report noncompliance to infection control immediately. Answer. A. Dispose of tissues in a biohazard bag and educate the patient. Rationale. The nurse must ensure safe disposal and reinforce infection control education to prevent droplet contamination. Question 37. A TB patient is being discharged to a community shelter. What should the nurse do before discharge? A. Notify the local public health department. B. Provide extra medication for self-administration. C. Arrange for family transport. D. Discontinue airborne precautions immediately. Answer. A. Notify the local public health department. Rationale. TB is a reportable condition. Continuity of care and public health monitoring are required upon discharge. Question 38. During patient care, the nurse's N95 mask accidentally slips off for several seconds. What is the best immediate action? A. Leave the room and perform hand hygiene. B. Replace the mask and complete care quickly. C. Leave the room, perform hand hygiene, and report potential exposure. D. Continue care and report later. Answer. C. Leave the room, perform hand hygiene, and report potential exposure. Rationale. The nurse must follow exposure protocol immediately for potential airborne pathogen exposure. Question 39. A patient with TB tells the nurse they have been coughing blood for 2 days but didn't report it. What should the nurse do first? A. Assess respiratory status and vital signs. B. Notify the provider immediately. C. Collect sputum for AFB testing. D. Document the symptom. Answer. A. Assess respiratory status and vital signs. Rationale. Assessment comes first in determining stability and severity before notifying the provider. Question 40. A nurse receives an order to start a newly diagnosed TB patient on therapy, but no baseline liver function tests are available. What should the nurse do? A. Administer the medications as ordered. B. Hold the medications and notify the provider for baseline labs. C. Begin therapy and draw labs after the first dose. D. Document and proceed. Answer. B. Hold the medications and notify the provider for baseline labs. Rationale. Baseline liver function tests are required before starting hepatotoxic TB drugs to ensure safe therapy initiation.